Hi, Dr. Shakib here from Irvine Spinal Wellness Center. This is Alicia. And Alicia, how pregnant are you?
24 weeks.
24 weeks, and I've been seeing Alicia for how long?
Like 12 years or something.
Since she was in high school, right? Or was it junior high?
I don't know. A long time.
A long time ago. But anyway, I see Alicia and her whole family. Now that Alicia's married, I see Alicia and her husband. And I look forward to meeting this little boy. So just wanted to do this educational video, so you guys see how we adjust pregnant patients. I'm going to use a diversified or manual technique on Alicia. And Alicia, you've been adjusted by progesterone activator before too. And the drop piece as well, right? Or did we not do the drop piece on you ever?
That doesn't sound familiar.
Okay, so those are the different techniques I just named. Like I said in previous videos, we do different techniques depending on the patient's case and whatever there are multiple reasons or situations we need to consider. So I'm just going to proceed adjusting my lovely lady. Alicia, are you seeing me for any specific reason, or are you coming here because you want to have better pregnancy?
Well, to help with the scoliosis.
Alicia has scoliosis, which is a side bending of the spine, but that's not going to stop the woman from riding. There we go. That already is gone. Breathe in for me. All the way out. Excellent. One more time. And out. Beautiful. Let's go on your knees and hands. I'm going to bring the table down. Now you get the side view of my pregnant girl. And now the behind view of the pregnant woman. So here we go. Nice and easy. Breathe in and all the way out. Gorgeous. Face the other way. Let's see if we'll move this here. All the way, nice and relaxed. Gorgeous. On your back. I think we are good. So like we were saying, Alicia has scoliosis or side bending of the spine. That typically runs in the family, but we're hoping the boy's not going to have it. Bend
Nice.
your knees. And so during pregnancy, there is a hormone called relaxin that actually relaxes the joints to accommodate the growing baby, but in the process, a lot of things can be misaligned everyone with scoliosis or without scoliosis. That means, well, in case of scoliosis, there's more misalignment cases, and any stress in the mom gets transferred to the baby. So we want to make sure the pregnancy goes nice and smoothly. And because my lovely Alicia is smart and comes from a smart family, your mom was seeing a chiropractor as a child too, right? If I understand, your grandmother used to take the kids to chiropractors?
I think so.
Yeah, so I see grandma too, by the way. Nice and relaxed, Alicia. Beautiful. One more here. Excellente. And that's our chiropractic adjustment of a pregnant patient. Thanks, Alicia.